Hey guys, hi. Welcome to Unacademy. This channel is Unacademy Future Doctors and I am your educator for biochemistry, Dr. Shivangi Shukla. Welcome to this session of MCQ based discussion. Here we shall be discussing questions, MCQs, and here we shall be discussing topics of biochemistry using MCQs. Okay, let me just check if I am visible and audible to everyone. Just let me check if the live stream has started or not. Okay, great. So welcome all of you, and I'll just quickly, till the others join in, I'll just quickly brief you about the different types of subscriptions for NEET PG that are available on the Unacademy app. Okay, I'm Dr. Shivangi Shukla, as most of you have been together for the past few months would know me. Alright, so on the Unacademy app, the NEET PG subscription is of two types. It is Iconic as well as Plus. Now, both these subscriptions will provide you access to video lectures from top educators across the country, not just live but also recorded. And you also get to access their printed notes in the PDF format and comprehensive question banks containing more than 25,000 questions, which are regularly updated. Okay, the USP of both of these subscriptions is that you can access all of these classes live as well as recorded at any time using any device of your choice, be it your phone, your laptop, your tablet, even in the comfort of your homes on your PC. Okay, and the Iconic subscription will also provide you with access to resources from Prep Ladder. So it is called Best from Two of the Best. Okay, and Unacademy has come up with a lot of state-of-the-art features like raise your hand, in class polls. Also, the most novel feature is the open house sessions that are 1:1 audio discussion sessions with the mentors. So we, the educators, will be holding open house sessions, and you guys can attend those sessions to clear all your doubts, clarify your doubts, whether academic, strategic, or whatever, on the open house session in an audio 1:1 manner, as if you're speaking to us over phone. Okay, so it has made the educators very, very accessible. Now, the NEET PG revision batch that Unacademy has come up with is specially dedicated to those students who are preparing for this year's NEET PG examination in May 2022. So these students can access these classes, and also there will be revision conducted using live lectures from more than 40 educators, and they will be conducting, they'll be giving you subject wise tests also, grand tests also, and a lot of revision classes. Okay, now whichever subscription you are planning to take, either Plus or Iconic, do not forget the educator code DRSHUKLA. Okay, this is the educator code that you have to put in at the time of checkout. While you're checking out, then you have to put this educator code Dr. Shukla, DRSHUKLA, and this code will provide you a whole 10% discount on either of the two subscriptions, whichever you are planning to buy. So do not forget, before checking out, before proceeding to check out, put in this code where it asks for the code. Okay, DRSHUKLA, Dr. Shukla. Alright, so the first question for today is, substrate level phosphorylation during the TCA cycle involves which enzyme? Is it A, succinate thiokinase, B, isocitrate dehydrogenase, C, malate dehydrogenase, or D, fumarase? Okay, now I'll be giving you 2 minutes per question. You have to answer in the comment section. Come on guys, answer. Your time has started now. Come on guys, last few seconds left. Okay, so the correct answer here is succinate thiokinase. Okay, what is substrate level phosphorylation? Substrate level phosphorylation is when there is formation of ATP directly. The phosphate group is not getting transferred from one compound to the other, rather it is getting added from the substrate level, from the scratch level. Okay, and this enzyme is succinate thiokinase, which is also called succinyl CoA synthetase. Succinyl CoA synthetase. Why is it so? Because can you see, this is the step that we're talking about in the TCA cycle or the Krebs cycle or the citric acid cycle. So this is a reversible step. The enzyme succinate thiokinase will catalyze this step in either direction. Therefore, when this is occurring in this direction, then succinyl CoA is getting formed, getting synthesized. Therefore, it is also called succinyl CoA synthetase. And why synthetase? Because it will utilize ATP in this direction. Okay, understood? Next question. Which of the following is not involved in ketogenesis? Is it A. HMG CoA synthase, B. HMG CoA lyase, C. Mitochondria, or D. HMG CoA reductase? Your time has started now. Come on guys. Do answer in the comment section. Come on, last few seconds left for you to answer. Okay, so the time is up for you to answer, and now the correct answer is D. HMG CoA reductase. And why is it so? Because have you heard, let us compare and contrast ketogenesis and cholesterol synthesis like we have been doing whenever we are reading this. Now what happens, the starting point for both of them is acetyl CoA. Acetyl CoA plus acetyl CoA will combine to produce acetoacetyl CoA. Okay, what is the enzyme involved here? The enzyme involved here is thiolase. Now, This acetoacetyl-CoA will then be acted upon by which enzyme? The enzyme is HMG-CoA synthase enzyme that synthesizes HMG-CoA. Okay, one more acetyl-CoA will come in, and what will be formed? Using which enzyme? The enzyme here is HMG-CoA synthase enzyme. Okay, now these are occurring in both ketogenesis and cholesterologenesis. And what is being formed? HMG-CoA. Now the fate of this HMG-CoA, it is different in both. In the mitochondria for ketogenesis, what happens is it is acted upon by HMG-CoA lyase and it produces acetoacetate. This acetoacetate will spontaneously form acetone, and using beta hydroxybutyrate dehydrogenase enzyme, it is going to form beta hydroxybutyrate. All three of these are ketone bodies. The most predominant ketone body is beta hydroxybutyrate. The first ketone body to form is acetoacetate. Okay. Now outside the mitochondria, that is extra mitochondrially, what happens is it is acted upon by HMG-CoA reductase in cholesterol synthesis. Okay, this is the rate limiting enzyme. This enzyme catalyzes this step, which is the committed step, the rate limiting step. Okay, so if this step is occurring, cholesterol synthesis will occur. If this step is not occurring, the whole of the cycle will be stopped. And the first step in cholesterol synthesis is formation of mevalonate, which is occurring using the enzyme HMG-CoA reductase. Now this HMG-CoA reductase enzyme is the target of which group of drugs, guys? Which group of drugs that lower cholesterol inhibit this enzyme? Fill in the blanks here. What are these enzymes that are what are these drugs that are cholesterol lowering drugs, and whose mechanism of action is to inhibit HMG-CoA reductase? Come on, I want an answer. No one? So these drugs are, what are these drugs? They are statins. Atorvastatin, rosuvastatin, all these drugs. Okay. Next question. Which of the following is involved in catalyzing the conversion of aldose sugars to ketose sugars? A. Phosphotriose isomerase, B. Decarboxylase, C. Oxidoreductase, or D. Hexokinase. Your time starts now. Answer in the comments section. Okay. Come on, I'm waiting for you to answer, guys. Last few seconds left for you to answer. Okay. So the correct answer here is, it is A, phosphotriose isomerase. Okay, now what does this do? This converts DHAP into glyceraldehyde 3-phosphate. DHAP is dihydroacetone phosphate. It converts it into glyceraldehyde 3-phosphate. Now both of these are 3 carbon compounds. Okay. Now there are 3 carbon compounds. They contain phosphate, both of them. So therefore the enzyme is phosphotriose. Triose means monosaccharides containing 3 carbons. So it is phosphotriose isomerase. Okay, isomerase means, now this is a ketone sugar. This is an aldehyde sugar. Both of them contain the same molecular formula but a different structural formula, because this is a ketone and this is an aldehyde. A similar example can be phosphohexose isomerase. Now what does this enzyme do? Phosphohexose isomerase. You remember this enzyme? It converts glucose 6-phosphate to fructose 6-phosphate and vice versa, because it is a reversible reaction, glycolysis. Now this one is an aldehyde sugar, this one is a ketone sugar. So this also converts aldose sugars to ketose sugar, isomerase enzyme. Okay, next. So this is what it does. See, triose, phosphotriose isomerase or triose phosphate isomerase. Similarly, hexose phosphate isomerase or phosphohexose isomerase. Next question. Which among the following is or are a marker for myocardial infarction? A. LDH, B. CKMB, C. troponin 1 or D. all of the above. Okay, this is a straightforward question, so I'll give you just 1 minute for you to answer. Okay, I'll give just 1 minute for you to answer this. Okay. Alright, so the time for you to answer is up. The correct answer is all of the above. Okay, all of the above are markers for myocardial infarction. Next question. All of the following are hexoses except. Now this is also a straightforward question, so I'll just give you 1 minute. Come on, start answering. The time has started. Okay, so the time is up. The correct answer is ribose. And why is it so? Because ribose is a pentose. What is it? It is a pentose. Pentose means it is a 5-carbon monosaccharide. Now, can you tell me and all these are hexoses. Can you tell me the difference between hexose and hexosan? Can you tell me the difference between these two nomenclatures? What are hexoses and what are hexosans? Can you tell me the difference? Come on. Come on, tell me the difference between hexose and hexosans. Any one of you? No one? So, hexoses are monosaccharides containing 6 carbons. Monosaccharides containing 6 carbons. Whereas hexosans are polysaccharides containing 6 carbons. Not 6 carbons, containing hexoses. Hexosans are polysaccharides containing hexoses, and hexoses are monosaccharides containing 6 carbons. Okay, understood? This is one major difference. Next question. All of the following are epimers except A. Glucose and galactose at C4, B. Glucose and mannose at C2, C. Xylulose and ribulose at C3, or D. Glucose and fructose at C6. Again, a straightforward question. I'll just give you 1 minute to answer. Come on. Alright, so the correct answer here is glucose and fructose. Sorry. The correct answer is glucose and fructose at C6. Why? Because we just discussed that they are isomers. That is why the enzyme isomerase was converting glucose to fructose. So therefore, glucose and fructose are isomers. They are not epimers. What are epimers? Epimers are those compounds that differ at the position of side groups about just 1 carbon position. Look at these. This is alpha D galactose and this is alpha D glucose. Now both are epimers at the 4th carbon position, because at the 4th carbon position the OH group on the 4th carbon is above the plane of the ring in galactose. Whereas in glucose, this OH group is below the plane of the ring. Similarly, glucose and mannose are epimers at the 2nd carbon position, because in glucose, the OH group is below the plane of the ring at the 2nd carbon, whereas in mannose, the OH group is above the plane of the ring at the 2nd carbon. Okay, but all this said and done, always remember that galactose and mannose are not epimers. Why? Because they differ about 2 carbon positions. 2nd, 4th, 2nd and 4th. Got it? So epimers will differ only about 1 carbon position. Understood? So, and this xylulose and ribulose we have heard of in which cycle? In the HMP shunt. Okay, next. Which of the following is true about ketone bodies? A. They are synthesized in the small intestine. B. They are preferentially used by the brain to glucose. C. They are produced during starvation. Or D. They are converted to HMG-CoA. Okay, your time starts now. 2 minutes for you to answer this question. The last few minutes left for you to answer. Now the correct answer here is they are produced during starvation. Now they are synthesized in the small intestine? No, the majority of them are synthesized in the liver. They are preferentially used by the brain to glucose? No, not at all. The brain utilizes 80%, the brain depends upon glucose and 20% upon ketone bodies. They are converted into HMG-CoA? No, we just read HMG-CoA is converted into acetoacetate, which is the first ketone body to form using the enzyme HMG-CoA lyase. This is occurring inside the mitochondria. In which organ? In the liver. So the correct answer is they are produced during starvation. Next question. Which of the following amino acids is the precursor of epinephrine? Okay. A. Tryptophan, B. Phenylalanine, C. Tyrosine, or D. Threonine. Your time has started. Come on. Come on, last few minutes left. So the correct answer here is tyrosine. Okay, what is the correct answer? Tyrosine. Now, tyrosine is a non-essential amino acid. Tyrosine is produced from phenylalanine. Phenylalanine produces tyrosine using the enzyme phenylalanine hydroxylase in the presence of the cofactor tetrahydrobiopterin. Okay. Now this tyrosine then converts to DOPA, which converts using tyrosine hydroxylase, which the DOPA then converts to dopamine. Okay. Now tyrosine also produces other catecholamines like epinephrine and norepinephrine. There is one hormone also which tyrosine produces, and what is that hormone? That hormone is T3 and T4, thyroid hormone. the tyrosine residues on thyroglobulin, they are iodinated by I+, and then they form MIT and DIT, monoiodotyrosine, diiodotyrosine. Now these two DIT molecules combine to produce T4, and one MIT and one DIT molecule will combine to produce T3. Okay, and they are usually present resting stored in the colloid. Whenever the thyroid gets stimulated to release its hormones, then they are phagocytosed inside the follicle from the colloid, the thyroglobulin molecule. Then this phagosome combines with the lysosome to produce phagolysosome, where hydrolytic enzymes are there. Hydrolytic enzymes will digest and remove T3 and T4 and secrete them out of the follicle to into the bloodstream. And then the MIT and DIT molecules and the tyrosine residues are recycled using the enzyme deiodinase. Okay. Now, tryptophan is also one very important. Now, tryptophan, phenylalanine and threonine, all three are essential amino acids. Now, what does tryptophan produce? It is also very important. Three important products of tryptophan which you should know. Tryptophan will produce serotonin, melatonin, and niacin. 60 milligrams of tryptophan will produce 1 milligram of niacin. The deficiency of niacin is pellagra, which is characterized by 3 Ds: dermatitis, diarrhea, and dementia. Okay, what type of dermatitis? Photodermatitis. What is one important sign? Castle's necklace. Okay, on the involving the exposed parts of the body. Now, which of the following occur in both the mitochondria and the cytosol? A. Heme synthesis, B. Urea synthesis, C. Gluconeogenesis, or D. All of the above. Okay, your time has started. Come on, answer in the comment section. Last 1 minute left for you to answer. Come on. Which of the following occur both in the mitochondria and the cytosol? Last 30 seconds left. Come on. Alright, so the correct answer here is all of the above. Okay. Now you have to go back and revise all these 3 cycles: heme synthesis, urea cycle, and gluconeogenesis. The first 2 steps of urea cycle start in the mitochondria. Then this heme synthesis also, the first 2 steps, that is till ALA synthesis, that occurs in the mitochondria, and then ALA goes out of the mitochondria until coproporphyrin synthesis, coproporphyrin 3 synthesis. It stays in the mitochondria, and then in the cytosol, and then coproporphyrin will again migrate to the mitochondria to produce protoporphyrin, and then that is pherochelated to produce heme. Similarly, gluconeogenesis, a lot of steps are occurring in the mitochondria involving the TCA cycle, like oxaloacetate converting to phosphoenol pyruvate and transamination reactions. And reverse of glycolysis also involves gluconeogenesis, and that is occurring in the cytoplasm. Okay, so go back and revise all of these cycles. It is very, very important. Okay. Now, next. Cholesterol is the precursor of all except, now this is the confusing question, so please pay attention. A. Bile acids, B. Bile pigments, C. Steroid hormones, or D. Vitamin D. Okay. Now pay attention to this and then answer in the comment section. Come on, come on. Attempt this question. I want to know your direction of thinking, how you are thinking. Come on. Very good, Priyanshi. Priyanshi has answered. Now let us see if it is correct or not. Is there anyone who wants to give in a different answer or even the same answer? You can key in your response. Cholesterol is the precursor of all except A. Bile acids, B. Bile pigments, C. Steroid hormones, or D. Vitamin D. Okay. So the time is up. The correct answer here is as given by Priyanshi. It is bile pigments. Now where are these bile pigments coming from? They are coming from degradation of heme. Where? In the spleen. Okay. Alright. So what is occurring? For hemoglobin is degraded to globin and heme is further degraded to produce bile acids. Sorry, not bile acids, bile pigments. And what are these bile pigments? Bilirubin, biliverdin. Okay. What are bile acids? Bile acids are produced from cholesterol only inside the small intestine. And what are these bile acids? What is the function of these bile acids? They emulsify fats. Okay. Bile acids will emulsify fats to ease and aid in the digestion of fats. Okay. Emulsification of fats so that they can be digested or the enzymes can act on them in an environment of water, in an aqueous environment. And fats are hydrophobic. Since fats are hydrophobic, so they cannot be mingled with water, and since they cannot be mingled with water, then the enzymes which are present in the aqueous environment cannot act on them, and it will be difficult for fats to be digested. Therefore, bile acids help in emulsification of fats, which means they form micelle. Micelle, the structure of micelle we have read how it is structured like this: a hydrophilic head and hydrophobic tail. Okay, and it encloses the lipid. Here is the lipid molecule, and outside is the aqueous phase. Understood? So this is how bile acids form micelle. Now, what are bile acids? Primary bile acids are glycocholic acid and taurocholic acid and glycochinodioxycholic acid and taurochinodioxycholic acid. Understood? So these are the primary bile acids. What are the secondary bile acids? They are formed by the action of the small intestinal bacteria on the primary bile acids. What are these? The secondary bile acids are lithocholic acids, and deoxycholic acid. Okay. Steroid hormones are also produced from cholesterol. Vitamin D is produced in the skin from 7-dehydrocholesterol converting to cholecalciferol. Then this cholecalciferol will be hydroxylated at the 25th position in the liver to produce 25-hydroxycholecalciferol. Now it will again be hydroxylated at the first position in the kidney to produce 1,25-dihydroxycholecalciferol, okay, which is the active form of vitamin D. Anyway, so this was it for this session. We'll meet again after 4 or 5 minutes in the next session at 6:45. That is 6:45. In about 4 minutes, we'll meet in the next MCQ based session. Till then, you can take a break, have some water, have some snacks, and then we'll meet again. If there's any doubt, you can ask me there in the next session. Okay guys, bye bye, take care, see you.